Okay, I think we're good. Okay, great. Okay, I think we'll start right at 6 o'clock, to be respectful for everybody that's logged on. I'm Maura Papile. I am the Director of Student Support Services for Quincy Public Schools. And I am really, really pleased to say that this is our 4th Parent Academy with Carolina Sareyed-Dim, who is our Behavioral Health Navigator from Quincy Asian Resources. And Carolina is just really, really outstanding. You will hear from her. Just a couple of things. This is a webinar format, so you won't be able to, participate, verbally by unmuting yourself, but you will be able to put any questions in the chat, and we'll be glad to answer questions as we go. And then we'll give some time at the end for everybody to ask questions or make comments, and we'll share those out. Also, we do have translation available. We have interpreters. So we have Sylvania, who speaks Spanish. We have Katie, who speaks Mandarin. We have Kelly, who speaks Cantonese. And Kelly will be under the Japanese option, on the translation. And Katie will be under the Chinese option. So we have Sarah also that speaks Portuguese. So we're really, really glad to have our interpreters available for you. So there's a little globe at the bottom of your screen. It might be under where it says more. And if you hit on interpretation, you can select your language. This will be recorded. So we will record this and then post this later. So thank you, everybody, for being here. I know people are busy. So we know, you've made important time for your family to see what kind of services we might be able to help you with. So we can go to the first slide. I'm going to talk a little bit about the grant, and then I will introduce the folks from Bay State Community Services who are also here with our Behavioral Health Navigator. So Beth Israel Lahey Health had a grant proposal out, and we were lucky enough to be the recipient of that funding. And I'm really proud to say that because we had a relationship with Beth Israel, I think that they felt like we are really good about our implementation when we get grant funding. So we have a history and a relationship with Beth Israel. They do a lot of good things for our community. And so they were looking at 3 large communities, Haverhill, Lynn, and Quincy. And they wanted to look at community-based behavioral health navigation. And we were really excited about that. So we were awarded those funds for the course of 3 years. And so it's over $300,000 grant for 3 years. And our implementation began this year. So this is the first year that we have Carolina. Go to the next slide. So there were core principles guiding, what they wanted to see happen with this funding. So they wanted to support evidence-based and evidence-informed strategies and programs, build community cohesion and capacity, and health and racial equity. So we wanted to make sure that everybody was getting, the services that they needed. And so it's been important for us to make sure that, the agencies, our partner agencies, were understanding, the needs of the school system, for families. And we understood our partner agencies and what they have to offer. So we did create a coalition where we meet once a month just to make sure that, if there's a family in need, there is some agency that can, do some outreach and help. And Carolina has built really great, strong relationships, and Bay State Community Services is definitely one of our partners that we have a long history and great relationship and partnership with. So tonight we do have Melissa Harrison. I don't know, Melissa, if you want to give a little bit of a wave. She's the Senior Program Director for Quincy Family Resources. We have Elyse Iveagh from Bay State Community Services, who is the Coastal CBHI Program Director for Bay State Community Services. If you don't mind giving a little wave, Elyse, that would be fantastic. And Katie Conley, who is a Program Coordinator from Bay State. So now I will hand the presentation over to Carolina.
Hello, everyone. I'm very, very pleased to be here today again with all of you, and I really appreciate you joining us. And I cannot say enough how grateful I am for the opportunity to be working as a behavioral health navigator and to be able to help so many families and students. And although the needs of our community are different, the work that we do as a school staff, as agency, as myself as well, is completely dedicated to support everyone's well-being, social and emotional mental health. So we genuinely care about our community, and we want to make sure that all of you receive the support and service that you need and you deserve. So what is my role? So I'm sorry if some of you already know, but I just want to reinforce that for those of you that don't know me, again, don't know my role. So, so my role is like a professional funded by a grant from the district that works to bridge, like to connect students, families, and behavioral health service. My role also involves providing a comprehensive support for families and students' mental and emotional well-being by helping them to navigate the challenges and access the necessary resources. And what are my key responsibilities? So one of them is assessment and identification. And that means recognizing the particular challenges and needs that students and their families need support, especially regarding mental health. The needs might be related to different kinds of factors that impact students' mental health, such as anxiety, depression, trauma, or some social and behavioral challenges. And usually when an issue is identified by a family, by a school counselor, teacher, student support team, or the nurse, we collaborate together in order to address it. And so the behavioral health service is also part of my job. And that means that after talking to students and the families, we do our best to align their needs to the service that is offered. So when doing the referral service, we usually consider such aspects, such as particular diagnosis and case, the type of the therapy that the parents are seeking for the kids, such as this home-based therapy, family therapy, individual, school-based, the agency location, the access to language support, and the health insurance that are acceptable. That is acceptable. And these considerations help to make sure that the referral are appropriated and meet the needs of the family and the student. However, it's very important to mention about the waiting list. So we should be mindful that due to the volume of referrals that some agencies receive, sometimes it's not possible to schedule an appointment, for example, for individual therapy, like right away. And sometimes the request might be placed on a waiting list. When that happens, we keep following up with the agency to check the status of the referral. Another responsibilities that I have is like supporting family. And besides helping families to connect and navigate to the mental health service, it's also important to understand the unique circumstances and cultural challenges that they might experience. So mental health can be affected in many ways, and some families sometimes they might face lack of access to food, health care, financial hardship, and all of those aspects also impacts the family overall well-being. So my role includes also supporting families by connecting them to essential service, which I will talk a little bit more like further, and even like connect families with mental health service for themselves. Another aspect is the collaboration with the school staff. So the work of the school staff are crucial part of the student and family support network that we do. So it's very important so it's impossible to talk about my role without acknowledging the essential contribution of the school staff. So one of the key aspects of my job is collaborating with guidance counselors, the principal, assistant principal, student support directors, school nurse, school-based clinician, and other school staff, whose teamwork is crucial to meet the needs and the support of our community. Our collaborative work enables us to provide the best support possible for students and family. And I'm truly grateful to work with such dedicated team that genuinely cares about their students and families. And lastly, but not least point is crisis intervention, which we provide the immediate assistance to students during critical situations such as thought of harming themselves or others. So we rely on the support of agency partners who work with us as well with school-based clinicians. So what are the ways that the behavioral health is integrated into the school culture? One of the ways is building the supportive and inclusive school environment where the mental health is validated and prioritized. And the ways of achieving that is by fostering open communication regarding mental health, recognizing that students and their families come from diverse cultural backgrounds, and that mental health approach should be taken into consideration of those differences. Increase and facilitate inclusive access for students and families to connect to mental health resources. And when I mention about inclusive, I mention about also making counseling accessible to all, and including service which clinicians speak different language to facilitate the communication. Also, offering behavioral health support by reducing the stigma and make discussions about mental health approachable. So some families might come from different backgrounds, beliefs, and cultures where the mental health is not fully acknowledged or validated, which can create barriers for seeking for help. So it's really, really important that we respectfully address these barriers by explaining what behavioral health is, the role of the professional in this field, and the potential consequences of not addressing mental health issues. And two other points that's really important also is supporting staff to recognize the behavioral health concerns and response appropriately to that, and encourage early intervention to prevent the development of more serious mental health issues. So here, so what the Behavioral Health Navigator has been done. So, of course, the primary goal of us is from the beginning are like to make sure that we help families to connect with therapy service. But what I realized when I call some families is that there are more need and more support that we should be doing in order to support like this comprehensive support also is also about mental health, but also about any other support that the family might need. So one of them, some of my task also involves like food pantry access and registration. So connecting families to agencies that provide food pantry service, making sure that they know the documents that they need to apply for the service, and sometimes meeting the families at the agency to help them to fill out some application. Also, mental health, health insurance assistance. So after speaking with some families and understanding the issue about their health insurance, I assist them by calling the organization, like such as Mass Health, for example, to present the issue when needed. I also follow up with any required documentation and help them to find and complete the necessary forms in order to fix the issue. And sometimes some students and families, they have like a limit plan. So I also help them like to check which agencies are associated to this plan and help them with the primary care doctor appointments and also dentist appointments. So it's different kinds of support. So as I mentioned, like medical and dental appointments, so calling the doctors with the family, helping them to schedule any kind of medical appointment that they need, and not only for their children, but also for the parents as well. Child care support and resources, employment assistance. So besides helping like parents, sometimes they experience like unemployment, like to find jobs. I also help the high school students that sometimes they are looking for jobs, like connecting them to the career office that we have here in order for them to be prepared for interviews, prepare their resume, apply for jobs. So this is like being like, I believe that's very helpful for them. Also, English classes. So some families, they really, especially the ones that English is not their first language, they really want like to improve their lives and make sure that they can get other opportunities. So I also help them like to connect to great agencies that offer English classes, and I help them to connect, to make sure that they are enrolled, to know the classes, and it has been like very rewarding experience for me to be able to also help the parents on that. I do also the interpretation service. I also speak Portuguese, so I'm very happy to help families. And even when families speak different kind of language, Quincy Public Schools has a very great support of the language line, which I can make sure that they can reach out to families, no matter with the language that they speak. So that's a very great support for us. And also, lastly is, and not least, provide support and build relationships with families, school members, and agency. This point is very, very special to me because it's not about connecting families to service, connect students to service, but also building connection among us. And this is very great, so we can better understand, embrace, and support each other. Even though I'm based in Quincy High School in Southwest, I work for all Quincy public schools from elementary to high school. So please feel free to reach out. I will leave my contact information at the end. So if you need any assistance, I'll be more than happy to help you. And lastly, talking about connections, we are so grateful to have like great partners and community resources that work very close with us. So we are able to provide this service because with these great partnerships that we have. So we rely on our valuable external collaborations with our community partners, as Ms. Maura mentioned, including QARI, Quincy Asian Resources, Aspire Health Alliance, Bay State Community Service, which is here with us today, Maria Dross Counseling's Walk Therapeutic, Quincy Family Resources, Big Brother and Big Sisters to help us support our families and students. Also important to say that sometimes families are unaware about the great service available to our community. So we want, especially in my position, I make sure that our students and families know about the great resources that we have for mental health resources and other very important service available in our communities, and have assistance and access to those services. And lastly, it's very important to say that our partnership with our community agencies reinforce the importance of helping our students besides the school hours. So they will have like the comprehensive support, like not only during the school hours, but also after. So as we are talking about our great partners, I want to pass over to our amazing community partner, Bay State Community Service, who will speak about the great service that they have to our community.
I do think someone did have a question in the chat for you, Carolina, about if you're a party of one, a department of one, do you do everything you described by yourself? I think.
Oh, Elsie, can you repeat, please? I'm sorry, it cut. I couldn't.
Oh, Erica asked in the chat, are you a department of one? I think a question for you.
Yeah, I,
I'm s-
yes, Carolina is totally amazing. I'll let you answer that, Carolina, too, but
uh-huh.
I do want to say that we wrote the grant, and the grant was for one behavioral health navigator for the district. So Carolina works with every school in the
Yes.
district. She doesn't just navigate. I forget, you won't brag about yourself, so I need to make sure people understand like how awesome you are. You know, she is meeting with kids and families, and not just once. It's not just like, hey, you know, what is it that you need, or what's happening? How can I help you with this one specific thing? But there's all kinds of follow-up, advocacy, translation, you
Exactly.
know, doing lunch groups at schools with Portuguese speaking students and other students, and meeting with parents wherever they're at, and all kinds of needs. So she is extraordinary. And, you know, she is really has been able to get to know like the services that are offered by the community and what the wait lists are. I think there's a question on wait lists. Um, you know, and we do have wonderful partners like Bay State. So Carolina, I'm sorry I answered for you, but you can, if you want to add anything.
No, no problem. I will add very fast. Not take time for Bay State, but yes, is what Miss Maura said, and we usually what I do. My service is not only about connecting; it's just like holding the hands until we get the service done. So it's just about like this, embracing what I need to do, like embracing the family and say, so you need this, we will get where you need, and making sure that the approach has this a cultural approach, and it's really about caring for the families. It's not about connecting, but it's about caring and make sure that we will get the service that they need, for sure.
So I can jump in and start. I think my slides are first. So I'm Elyse Iveagh. I'm the program director for Coastal CBHI, which you can go to the next one. CBHI stands for the Community Behavioral Health Initiative. You can go to the next one. It has a little more details on that. So the Community Behavioral Health Initiative began as initiative that resulted from a class action lawsuit. So basically, children enrolled in Mass Health weren't didn't have effective behavioral health services. They were basically going from outpatient therapy, which is office-based, once a week or less, typically, sometimes twice a week, but not necessarily available off hours. And then something would happen and that child might be unsafe and they ended up in a hospital, and there was really no in between, no stabilizing service. So long story short, the initiative pays for a continuum of services that I'll explain more in depth, that are based in the community, based in families' homes, and based in schools when we have sort of agreements like this and are you know, can coordinate effectively. They can meet with clients in schools as well. It also created the requirement for primary care doctors, like pediatricians, to screen for behavioral health conditions and at least start the process of making referrals or starting some assessments at the annual well child visit. And it created some standardized behavioral assessments to document strengths and needs for these clients, so that if they go to different providers, there's some sort of consistency and shared understanding of what these assessments mean. Okay, you can go to the next one. Thank you. So I'm the program director for these two services, the in-home therapy and therapeutic mentoring programs. So with in-home therapy, you have a master's level clinician who delivers intensive therapy twice weekly. So either two separate sessions or one session, but they have to consist of some individual time and some family therapy time. So the family therapy is a core component of in-home therapy, because there's a need there when children are at this level of intensity where they may be unsafe or have to be removed from homes. or have to go into hospitals. A lot of different types of clients. I'll talk about that a little bit after, but the purpose is to bring that therapy into the home and involve all of the family members to help stabilize that child, or to help adjust to a change. And then the perk of it, I guess, is the clinicians can take the clients into the community, so they can go play basketball at the park or help them sort of get into like an extracurricular activity, or you know, go for a drive. I've had entire sessions, just in a car with teenagers listening to music and talking, and gives you that flexibility. And then therapeutic mentoring can also do those community activities, and it's really more one-to-one with the child. So it doesn't include that family therapy element, and that uh, provider is also bachelor's level. So they don't have a master's degree. They're not eligible for a license, but they do have experience and a relevant bachelor's degree um, to kind of handle the kids with this level of need. But for therapeutic mentoring, when a referral is placed, there does have to be some other type of therapist connected with that case. So whether it's an in-home therapist, an intensive care coordinator, and I'll talk about that role after, or an outpatient therapist, there has to be some kind of provider. Unfortunately, right now, a school adjustment counselor can't be a hub for a TM. I wish they could. It would make this a lot easier, um, but they can't. But we, at least if they have an outpatient therapist, they can get a mentor. So, or any of the higher, more intensive services. And then the other program that's within our department, there's a different program director, but we work closely together, is the Community Services Agency, which there are CSAs throughout the state. They cover the entire state of Massachusetts with the different regions. I don't know exactly how many there are, but there are a lot. Every town is covered. So we cover the South Shore area. So intensive care coordinators are clinicians or social workers. They can be bachelor's or master's level. Their tasks differ a little bit, but they coordinate care planning teams. So they don't do therapy or interventions, but they do assessments and find resources and bring the teams together and do a lot to provide like a holistic wraparound care for the child. So a care planning team is first and foremost the family, the caregivers of that child. If the child's over 10, we really like them to be involved in their own meetings as well. Their community support people, anyone who kind of cares for that child, is invested in them. They could be a coach, like religious leader, someone from the community, providers, therapists, anyone providing services, someone from school, state agencies if there's DCF involved, or that's Department of Youth Services, or sorry, Department of Children and Families, Department of Youth Services if there's justice involved, Department of Mental Health, any of those state departments, or really anyone kind of involved in the youth care can be at those care plan meetings. But the key piece that makes it different from like other types of structured meetings like this is that they put the youth and families' voices first and really prioritize what they identify as the core issue and where they want to start, and empower, create opportunities for the families to make informed choices about their care instead of being told what they have to do next. So that's the care planning team. That team develops a care plan, and they support the family in engaging that, including making referrals, or facilitating communication with providers. And then the other service that's under the CSA is family support and training, which is also called a family partner. Sometimes they're paired with the SEC, sometimes they're on their own, but that is a hugely beneficial role. A provider who has lived experience caring for a child who's been involved in some kind of system, whether it's mental health or the justice system, or developmental disability services, any services navigating these complicated systems, and experience they have with that, then they can bring that into their work, coaching and supporting parents and caregivers going through the same thing. So it doesn't, that's not role that requires a degree or requires a certification other than, you know, having that experience and having an understanding of these systems and being able to connect others. And I think we can go to the next one. Yeah, so I kind of already touched on these, but it's youth guided, family driven. We really try to help the youth find their voice in those meetings or in the family sessions. All the services under CBHI always focus on identifying the family and the client's strengths that they can bring into sessions and services and meetings to work towards their goals. The services are integrated across. We collaborate with every type of service, schools, and we're very much invested in kind of these partnerships with schools. But from schools to hospitals to outpatient to you know, the basketball coach, like everyone invested in a child is part of this process, if the family wants them to be. And kind of speaking to that is we're culturally responsive, and we are open about being receptive to families' personal values, beliefs, norms, how they view these issues, you know, with the ultimate goal being kind of stability and peace and cohesion. So trying to mitigate conflicts, but with a respect to all beliefs. Okay, next one. So just really quickly, we take referrals for these services based on medical necessity. So for in-home therapy and intensive care coordination, there does have to be a fairly significant level of need where there's a safety issue or something's just kind of gotten to the point of being really challenging to manage at home or at school. There has to be some kind of diagnosis of a mental health condition for that child. Any hospitalization or even an evaluation by a crisis team can spur a CBHI referral. Any kind of thoughts or feelings about wanting to harm themselves, harm others, behaviors related to self-harm or harming others, significant aggression, anything that's kind of risky, dangerous, substance use, running away, any risk of removal. And then sometimes it's the reverse, like if a child has been in a program or has been in a foster placement for some reason and they're getting reunified to a family, sometimes CBHI is appropriate in those circumstances as well. So the referral process there is a form for providers. I think most providers in Quincy public schools have been sent that form. I'm happy to send it out to anyone who reaches out to me directly. But the nice thing for parents is that if you don't have access to that form and you don't have a provider that you can ask, I mean, you can all ask someone at Quincy schools, but if that weren't the case, there's a phone intake line. So any parent can call that number and they'll be walked through the process by Mika Marie Carmody. She's our intake specialist. So she'll help walk through kind of the questions and the information that's needed to fill out the form and complete a referral. So she would ask questions about the symptomology, diagnosis, insurance, those kinds of things. So like I said, so anyone can provide a referral. All legal caregivers must consent to services. So anyone who has custody of the child has to consent at least to services. They don't necessarily always have to participate, but depending on the situation. But everyone has to kind of agree to participate or agree to the service. And then, like I said before, therapeutic mentoring, as well as the family partner role, if it's standalone, they have to be placed by a hub provider, by a provider with a master's degree, like an in-home therapist, an outpatient therapist, a care coordinator, and that it has to include the clinical documentation with an identified goal. So if you have a provider, you need a mentor, or you feel like you want to get a mentor and need help finding a provider, most outpatient therapists have some awareness of what a therapeutic mentor is, but you can always call those numbers, the referral line, to get more information about what's needed. I'm trying to think if there's anything else about the intake process. I think that's about it. Just that these teams work, even the hub and the mentor teams work very cohesively together. So it's all kind of very collaborative and teamwork oriented with the family at the center. All right, I think that's it for this one. You can go to the next one. I think that just has our contact information. Yeah. Actually, that second name is out of date, so sorry about that. That was a recent change, but I'm Elyse Iveagh. That's my email at the top. Um, the clinical director of our program, her name is Caitlin Tebow. She's new to the agency, so she would be the other contact person. But if you have my email and you have the referral number, that's all you would need to get services. Right now, we have openings for female mentors. We have male mentors on staff, and it's about a 2 to 3 month wait for in-home therapy. I think that's about it for our tide. Thank you.
All right, so I'm Melissa Harrison. I'm the Senior Program Director at the Quincy Family Resource Center, located right in Quincy Center. So as far as an overview, there's an FRC in every county of the state. So it's a statewide initiative. And it started in 2015, and it was based on kids that were not going to school, having difficulty in school, having difficulty at home. They would end up in court. And what came to light over time was that a lot of times, similar to what Carolina mentioned, a lot of times you're seeing these behaviors in the kids, but there's other things going on at home that is affecting them and affecting their behavior and affecting their responses. So, so the state developed the Family Resource Center programming. Right now, there are 33 FRCs across the state, and that's grown from, I believe it was 12 was the first rollout. So in our area, we cover all of Norfolk County and the South Shore to access and navigate resources in their local community. So when we get a referral, we're not just referring families to Quincy-based programming. We will look and research what's in their area. So if they're coming from Stoughton, or if they're coming from Hingham or other areas, we will look for services that match up with their needs and their community. We do on-site and virtual programming services, and we do community-based activities to benefit families. So different things that we do are, we do a holiday toy drive every year. That's one of our biggest events. We also do family child engagement activities. We do a backpack drive every summer. And we'll do different seasonal activities and events as well. And then around the collaboration, we collaborate with state agencies, community organizations, towns and cities, school systems such as Quincy, DCF, the courts, and pediatricians' offices as well. So all services and activities are free of charge. No insurance is necessary. The only reason we would ask for insurance information is so that we connect families to a provider that accepts their insurance. So the 3 tiers of support is what we provide. So the first tier is called assessment and family support planning. So again, that is a family coming to us either they came themselves or they were referred to us and needing an assessment of what might be going on with the child and the family. It's usually about a 2-hour session. And during that session, resources and identified needs will be developed with the family, so they have a voice. And then there's follow-up after the assessment. So there's a family partner and a clinician that does the assessment, and they will follow up after the assessment is done to see if the family was able to connect to the providers that were recommended, or if, they needed any help navigating. The second tier, we can go ahead. We can go to another slide. Okay. So who is a good fit for an assessment? They're at-risk youth between the ages of 3 and 17 who may be struggling with behavioral or mental health concerns, some reactions to trauma, school avoidance and truancy, substance misuse, and as I was mentioning before, the child requiring assistance, risk-related concerns. So that's, not going to school, running away, risky behaviors. So the second tier of support that we provide are resources and referrals. So as I mentioned earlier, a lot of families are struggling with other needs. So whether it's basic needs, financial insecurities, housing insecurities, we will help connect them to providers that can help with those basic need resources. We help the families find the resources in their community that meet their needs. And then, we'll do a resource appointment. We can do it by phone, we can do it by appointment or walk-in, but we will help anyone that walks through our door. And the primary point of contact for resource assistance is from our team of family support workers, but everyone does everything. So anyone that you talk to would be prepared to help you. So examples of referrals that we'll do: therapeutic referrals, diversion cases from court, we'll deal with school attendance, we'll communicate with schools and adjustment counselors, and we also provide school supports in that we have a school liaison who is our point person around building relationships with the different school districts in our area. And she or he will help families who are struggling with the IEP process or not understanding what school supports they have rights to. So we will help them navigate that system as well. We are not advocates, however, so we're not educational advocates, but we are educational supports. So the other thing that we're all about is eliminating barriers. So things like translation services. If someone needs to get here for any services, but they can't afford the transportation or they don't have a car, we can help with that. During any groups that we run for caregivers and adults, we provide free child supervision during that group time, as well as meals or refreshments. And then we have flexible hours that we're open. We're open late 3 evenings a week. Tuesday and Thursday, we're open until 7:30. Wednesdays, we're open until 6. And then on the second and fourth Saturday of each month, we are open from 9 to 12. And again, all services are free. And the other tier that we do is groups and events. So we have caregiver and youth groups to address different needs, whether it's positive decision-making, behavioral health groups, parenting education groups, grandparents raising grandchildren supports. And then we'll do different recreational groups or support groups like workshops, life skills, wellness, family fun, LGBTQ plus youth. You know, we create different support groups and different recreational groups based on the community need. And then we'll do the community outreach and social events throughout the year, as I mentioned. So holiday assistance, backpack drive, and then we'll do things like a out of school event. You know, we'll do car seat events. We'll do a trunk or treat. Different things to kind of provide some family-friendly activities. So these are just some example flyers of the different things that we are offering right now. So the different parenting education groups, some are virtual, some are in person. We have a drop-in time called Life Out Loud that's meant for young adults and youth who are 16 to 24 who are trying to navigate transitioning into adulthood. We have the Hearts program, which is kind of talking to kids. It's a psychoeducational group around substance misuse. We have a family child engagement activity every 2 weeks that is called the Book Nook, and that's intended for kids age 5 to 11, and they'll read a book, do activities connected to that book, and it's a family-friendly activity. And then we do Cool, Calm, and Collected, which is an anger management group. And we also do different workshops, again, based on community need. So recently we did a special education workshop focusing on helping families plan for the transition of their child who may have some significant needs moving into the adult system from the youth system. So who can make referrals? Really anyone. Parents, grandparents, caregivers, schools, courts, pediatricians' offices, other behavioral health providers, and a self-referral. You can walk in, you can call to get assistance. And yeah, this is the role of the school liaison slide, which I kind of went over already, offering the educational workshops. We also have on site a health law advocate's attorney who works closely with our team to address specific special ed concerns. And the school liaison, you know, can meet individually with families regarding IEPs and the process, answering questions, helping them to understand the documentation, which can be overwhelming, and then seeking services outside of school. And the different roles are my role. We also have a program coordinator. Her name is Katie Conley. She wasn't able to join tonight, but she assists with the operations of the program. Then we have a licensed clinician and family partner who has lived experience that do the assessments together. And oftentimes the school liaison will join those assessments also. And then we have family support workers who, again, connect family members to community resources and making referrals. And they also develop the activities and the support groups, and all the staff are trained in the parenting education programs. So everyone gets involved in running the groups. And then we also have an administrative assistant who kind of manages our communication with the community as well. And just some pictures of a couple of our events that we participated in or hosted. And then this is an example of the holiday assistance programming that we provide, the holiday toy drive. That's all the bags in the kitchen there. We'll provide food assistance too for the holidays. When we are able, we rely a lot on donations and grants as well to help fund all of these. We do an Easter basket event every year as well. And that's just the table covered with toys that from the holiday toy drive. And that's the backpack drive. We have assisted over 300 students annually with backpacks during the month of August. And then we also partner with Free Period, and that is an organization initiative that provides period products and supplies to families in need. Because as we know, that's not covered by insurance or healthcare or anything like that, but it is definitely a basic need and can be a barrier for families if they can't afford to buy them. And that's just our space. Very welcoming. We welcome everyone. And then this is a list of our contacts for the family support workers, the school liaison, the whole team, the family partner. You can connect with us at any time. We also, we get back to any calls or referrals within 24 to 48 hours. That's it.
Thank you so much. That was really, really comprehensive. As you can see, Bay State Community Services really is a hub and offers so much to our families. And I just want to commend you on your work. It's been, amazing. We could have a behavioral health navigator that would navigate to nowhere, right? But we have such amazing services and partners that are committed to our community. They've been doing it a long time. And we are happy to, partner and connect families. We do have a parent in the chat who I will get the contact information to you, Carolina. So we have a parent that's looking for grief services. So we're really sorry about your loss, and we will get you connected. And we will post this presentation on our website, and there's a recording that will be posted as well, so you can go back, and for people that have not been able to participate tonight, they can go back and they can watch the presentation. So we will take questions or comments or anything in the chat and share it out. I do think that there was another parent that was looking for help with English classes. I tried to read Spanish, and I think I got the message. I think I I think that was the ask.
And Ms. Maura, and they can feel free like to take a picture of our contact information. So if they need any help like with English or anything else, they can, sometimes it's easier, like they can call me. My mail is a little bit long, so if you would like to call, that's fast. I always have my phone with me, so feel free to reach out for sure. And also I put everybody else that's from Bay State as well, it's here.
Great, thank you, Carolina. It's awesome. I don't know if Elyse or Melissa had anything else that they wanted to talk about?
No, just thank you for having us.
Looking forward to continuing our work together.
Yeah, thank you both so much. You're really terrific and we appreciate you so much. And I know our families always find an advocate at Bay State Community Services to help them, so we appreciate your work. I'm not really, people are saying thank you in the chat, which we really appreciate. Maybe repeat that answer and dismiss that. Oh, okay, the answer. Well, the interpreter should, I believe the person must be using the interpreter services in order to get the question in the chat. So I'm not sure that we have to repeat that answer in Spanish. I don't speak Spanish, and Carolina, you speak Portuguese only, correct?
Yeah, so I can, so Ms. Mo, I will just stop sharing to have access. Let me see if I can have access to this. I do. Let me see where is.
I think they probably, for someone to participate in the chat, they probably would be using the interpreter service, I would assume.
I think.
Maybe, I hope.
So let me see if I can find the.
So I think it was Fernanda who was,
Maybe they are just giving direction on how to listen the in Spanish, the translation in Spanish here.
yeah, it looks like Fernanda is saying yes.
Yes,
I think
yes.
she, I think she is engaged with the interpreter.
Oh, okay. Oh. Yeah, regarding the English classes, feel free to reach out to me. I'll put here again my contact information, and I can definitely connect you. And even like we call together to this English agency with English agencies that offer the classes, and we can. They have some openings right now, so I have been helping to enroll some mothers to these classes. The classes are free, so feel free to take a picture of my phone number, 617-845-2195, and I will be more than happy to help you connecting to them and call there with you as well.
Carolina, did you want to put your slide up so that your information is your information on one of the slides?
Yes, so can you see here?
Oh, you're right there. I'm so sorry.
My phone, yeah, because
I
the
was
chat
looking at the
was
base
covering.
Yeah, there we go. Perfect. Did we have the survey on here?
Yes, we do.
Okay, so the last thing, if people wouldn't mind completing our survey, just to give us some feedback about the presentation. So if we need to improve, we'd love to be able to do that to make sure we're being helpful when we hold parent academies. So that they would use a QR code and complete the survey. I think it's not many questions. We appreciate it. We're just going to leave it up for a few minutes. But Carolina, it looks like that parent that wanted to take English classes got your information, so that's good.
Oh, perfect. Thank you. Thank you. I'm looking for your call. And not only, as I said, not only for English classes, so any kind of help that you need, like the connecting to the to mental health service, like and if we have to help you with insurance first, like to be able to access the service that you need, we will go through the process together for sure.
Yeah, thank you to Erica for saying that she'll complete the survey. She was driving, so
Thank you.
I
Thank you so much.
appreciate that. Do you think we're okay? I think we probably could wrap up.
Yeah.
Okay. All right. Well, thank you, everybody, and please reach out if we can help. And thank you for being here.
Thank
Take
you so
care.
much, everyone. Bye-bye.
Bye-bye.
Bye.